It is, Sarah, and Sarah, you would know that if you have not driven this before, it can catch you off guard. This is Highway 170, Highway 100, I should say, and Highway 70. They are not one and the same, even though they do meet right here at this particular intersection. The issue becomes right what you see right now, the two traffic lanes from Highway 100 and Highway 70 coming together, and then people trying to make turns using their best judgment as far as when to yield and when not to, and then trying to make turns into small businesses. All of it collides together, and unfortunately that means traffic accidents. 93 of them over the last 3 years at this particular intersection. A lot of them have nothing to do with weather. They happen in the middle of the day with clear visibility. State Representative John Ray Clemmons says a lot of it has to do with just confusion.
But it looked like, based on the data that I have, that drivers weren't expecting what they approached. And I guess that's what we're really getting at here from a vehicular safety standpoint. And especially if you add pedestrians to the equation, it's a whole nother ballgame. I mean, there hasn't been any accidents there because most people just don't walk in that area. They know better.
So you can hear it right there, and he's right. There has not been a lot of pedestrian traffic that we've even seen out here this morning, and so far that we've been here. We've also just heard the horns honking and nearby businesses saying they hear tires screeching all the time here in this area, trying to avoid accidents. So what can be done to fix it? The city and the state is coming together with a plan.
Experiencing a shortage of respiratory care experts due to the pandemic burnout. According to the Tennessee Department of Health, we have more than 500 people who are on ventilators right now because of COVID-19 across the state. There are about 2,000 ventilators in the state of Tennessee. Craig Brooks, a ventilator therapist with Vanderbilt, says there just is a shortage of machines. Not a shortage of machines, but the respiratory therapists are being sent all over the place to provide care for all these patients.
The increased workload that we have experienced has put a higher stress than normal on most respiratory therapists because they want to provide that care for their patients. And sometimes they feel the pressures of not being able to spend as much time with each individual patient because they're being pulled in so many different directions.
Brooks says there are more than 60 openings right now for respiratory therapists, and this is just at Vanderbilt. He says the workload that these men and women have been dealing with is truly remarkable.
The beginning of the fall season brought a push from the CDC asking people who are pregnant to get vaccinated. Katie Schnabel, a new mother to an 8-month-old baby girl, was pregnant during the height of the pandemic. Schnabel, who is now vaccinated, says the shot was not yet available to her when she gave birth, but if it had been...
I wouldn't have been one of the early adopters. I would kind of had waited it out and seen how it went, and then based on that research, gone ahead and made my decision.
Dr. Jennifer Thompson with Vanderbilt University Medical Center works with pregnant women. She says the most common vaccine question she gets is it safe in pregnancy? Thompson says yes.
We can give the vaccine in any trimester of pregnancy. Pregnant patients experience similar side effects from the vaccine as the general population. So roughly about 15% of patients may have side effects after the first dose.
Fox 17 reached out to Metro Public Health to learn how the department is continuing to ensure pregnant people can get the information they need. While we did not receive a response, Thompson says getting in touch with your doctor is a start.
I think that they need to hear more from the people that they trust. We know that their healthcare providers or people that they trust, and being able to take that time to talk through all of these things.
In a Fox 17 Twitter poll, early results show the majority of people voted that they disagree with the CDC's latest guidance. And this all comes as health leaders are pushing for more to get the shot, saying the benefits outweigh the potential risks. Now, according to the recent CDC advisory, there were 22 COVID-related deaths in pregnant women in August alone, the most out of any month during the pandemic. Now, you can vote on what you think about the recent advisory by heading to our website, fox17.com.
There's $200 million behind it, providing before or after school care to combat learning loss, tutor these kids who've lost time and time in the classroom because of COVID-19. Between closures, quarantines, and virtual and hybrid learning, school leaders say many of our children have fallen behind.
As hard as everyone worked last year, and our parents were great, our students were great, our staff was incredible, there was still, it was an impact.
This funding will continue for 3 years and 2 summers, with schools footing about half the bill. Soon they will be looking for volunteers to help all these children. Most anybody can do that after they go through a training course.
It can be college students, it can be moms who have not re-entered the workforce at this time but need something a little part-time. Definitely our certified teachers are eligible to do that.
Each of these school districts will decide for themselves how best to implement this program. Most are still trying to put a plan together. Now, to see if your child's school district is participating, again, there are many across the state, 79 as we say. You can go to fox17.com, Nashville's #1 source for online news and information, to find out.